Hello guys, welcome back to my channel. My name is Divya. I am CPC certified medical coder. Today we'll continue our musculoskeletal system series focusing on the two important topics, that is tendon origin injection and the plantar fasciotomy. So we have covered the trigger finger, carpal tunnel, cubital joint and muscle injection. So today we'll see the two important topics. So let's start, guys. So, uh, it's six number. Okay. So that's a tendon origin injection. So what do you mean by tendon origin injection? Why it need to be inject at the tendon's origin? So if a patient having an inflammation at the tendon site, then what will a physician do? He will inject that at the medicine at the point where the tendon attached to the bone, to reduce the pain and inflammation. So the most common site is, that is, lateral epicondyle and the medial epicondyle. Here you can see that. So here is that a tendon origin injection is when a physician injects a medicine at the point where the tendon attaches to the bone origin. As the name saying, tendon origin, at the bone origin, to reduce the pain and inflammation. And the most common site, as you see here, lateral epicondyle and medial epicondyle. So diagnosis may be the tendinitis and inflammation of the tendon attachment. Okay. Now, what will physician do in tendon origin injection? Before coding the ICD and CPT, we have to know that what a physician do. So first of all, physician will identify that tendon's origin. Okay. After the identification of the tendon's origin site, then he will clean that area with skin antiseptic, and some imaging guidance will be there, and insert the needle at the origin with having the medication, and remove that needle and applies the dressing. So here you can see that M77 series is an ICD, and CPT is to 20,000, that is 20551. So let's see one example of OP report. That is an I will show you what a physician has done. Okay, I will show you navigation. So here is an OP report. You can see that is a lateral epicondylitis, preoperative and postoperative shame. So in the procedure performed, injection at the tendon's origin, and operative procedure is the patient was positioned in right elbow and area was prepped and wrapped and solution in the sterile fashion, and the point of the maximal tenderness at the lateral epicondyle tendon origin was identified, and the needle was introduced at the tendon. So here you can see that the key points you can see, that is a point of maximal tenderness at the epicondyle, lateral epicondyle, that is a tendon's origin. Okay, so first he physician identify that area. After that, the needle was introduced at the origin site, and then injection is given at that site. So here is an anesthetic and corticosteroid injection, and the patient tolerated the procedure well, and the needle was withdrawn. So we'll see the navigation of the uh, lateral epicondylitis. Okay, ICD, epicondylitis. It's on lateral side, right side you can, and not wish to code more. Lateral epicondylitis, that is M77.1. And next procedure is injection at the tendon's origin, epicondyle origin. Okay, so injection injection at the tendon origin injection. Okay, so it's an 1, not wish to code more. So it's 20551. So that this way we can navigate that. and it's in right side, then we'll give the modifier right side. Okay, so that's it. Now coming to next, that is plantar fasciotomy. Let me, okay, plantar fasciotomy. Okay, now next topic is plantar fasciotomy. So what is plantar fasciotomy? What is plantar fascia? So here you can see that the image, that is an foot image, and here you can see that a ligament, long ligament, as the name here given, long ligament that connects the calcaneal bone to the toes, that is phalanges area. That long thick band tissue in the sole of the foot is known as the plantar fascia. Okay, once more again, listen. So here is a long ligament, you can see that in the sole area of the foot that connects the calcaneal bone in the heel and phalanges, that is known as the plantar fascia. Okay, so if there is an inflammation in that area or some issue in that area and some conservative treatment failed, then what physician do? Physician will surgery at that area. Physician will do plantar fasciotomy. Okay, so plantar fasciotomy is nothing, it is a surgical procedure where the plantar fascia is partially cut or released to relieve the tension and the pain, mainly done for the chronic heel pain, plantar fasciitis. Okay, it happened due to the prolonged standing, running, jumping, and the obesity. So understand what is plantar fascia? It's a long thickened band tissue ligament that present at the sole of the foot that connects the calcaneal bone to the phalanges of the foot, that is known as plantar fascia. And if there is an inflammation in that area and conservative treatment is failed, then what physician do? Physician will partially cut that area and relieve the tendon, relieve the tension and the pain. Okay, now, so as I show that anatomy, what is anatomy? So plantar fascia, as I said, that thickest fibrous band tissue ligament that is present on the bottom of the foot, that is on sole of the foot, and that connects the calcaneal bone of the heel and the phalanges, proximal phalanges, that is toes, that is known as plantar fascia. Here is in structure medial cord, lateral cord, and the central cord. And what it helps, their function, what is the function of plantar fascia? It acts as a shock absorber or maintaining the arc of the foot. Now what a physician do, treatment will be, if conservative treatment fails, then what physician do, he will release that area or cut that area. So uh, so here we physician what do, open plantar fasciotomy, percutaneous plantar fasciotomy, endoscopic plantar fasciotomy. So the extent of the diagnosis is same, but treatment is something different. In open plantar fasciotomy, physician will make an incision. Okay, physician will make an incision to that area and partially cut that area and close the closure has been done. And in the percutaneous plantar fasciotomy, similarly needle is used. In the percutaneous, needle has been used, minimal incision has been done on the medial aspect of the heel and some guidance and non-direct visualization will be there. Okay. In the third, that is endoscopic plantar fasciotomy, as its name saying endoscopic, physician will give the anesthesia first and the incision has been done, small incision, and the endoscope inserted and physician cut the plantar fascia partially and then close that area. Okay. And the second one is plantar fascia injection. Okay. That is fasciotomy and here it is injection. Some injection is given, that is 20550 and with some medication. So when we see the operative report, we'll know that how it occur. Okay, so it's a modifier, we can append a modifier as per Okay, so here is an operative report. I will give you example operative report. Uh, Here is a pre-operative diagnosis is plantar fasciitis, right foot. The post-operative diagnosis same as the pre-operative diagnosis. Procedure performed endoscopic plantar fasciotomy, and the operative procedure detailed. Patient was placed in the supine position and the right foot was prepped. So here right foot anatomy, we got that right foot prepped and wrapped, and regional anesthesia was administered, anesthesia given, and small portal incision was made, and the medial spect of the heel, and the endoscope was introduced to visualize the plantar fascia. So here incision made, uh, endoscope introduced at the plantar fascia of the heel, and under the endoscopic guidance the plantar fascia was identified, partial release was performed using cutting instrument, and adequate release of the fascia was confirmed, and the endoscope was removed, and incision was irrigated and closed, and sterile dressing was applied. We'll see the um, navigation of that. Okay, so plantar fasciitis of the right foot. First of all, ICD, fasciitis. Okay, so it's in plantar, northwest to Codemore. So here fasciotomy, no? Fasciotomy is done, not fasciectomy, fasciotomy. Fasciotomy endoscopic is given, na? So endoscopic. So here you can see that here is an first delete that endoscopic plantar fasciotomy. So it's an right region, right foot. So we'll append the right RT modifier. So RT modifier. So that is the plantar fasciitis. Next topic we'll cover on the next upcoming video, because it's an tendon repair. It's a very long topic. So that's it for today, guys. Okay. So please like and subscribe my channel.